There's a lot of exciting stuff happening in hemophilia and promises for the future. Gene therapy gets a lot of press, but it's good. Plain factor therapies, I believe, are still the way to go because we know how to use them so well. Hemophilia B has become a very neglected disease with the recent approval of emicizumab. Hemophilia has a patient population devastated by disease, needing knee replacements, fatal bleeds. It's an ever-present worry for families and children finding a vein to treat the patients. So what Catalyst have been doing is developing a subcutaneous way of administering factor 9 and factor 7A for patients with inhibitors. It's not just the convenience of a subcutaneous injection. It's the fact that we use the pharmacokinetics of subcutaneous delivery, which prolongs the half-life to achieve equivalent half-lives to the extended half-life intravenous agents. My vision is to deliver normal levels, greater than 50%. This is something that has not been possible before in hemophilia B. We typically talk about time to 3%, time to 5%, and a lot of the time with extended half-lives, patients are at risk of bleeding, especially before the next injection. We plan to have minimal levels in the normal range all the time, and they will only increase a little bit above the 50% level, and this will provide the ultimate protection, not just the bleeding from joints, but also mucosal bleeds. We know that bleeding occurs in the brain. Even without macroscopic bleeding, bleeding occurs in joints. Normal levels above 50% will prevent these microbleeds. Our vision is that hemophilia needs to be no more bleeding. In the past, we've counted annualized bleed rates. We talk about the bleed rates, but our vision has to be better. We can definitely deliver that in the future for hemophilia B. Patients with inhibitors have always been the more difficult population. Emicizumab can now treat hemophilia A with inhibitors, so hemophilia B with inhibitors is a rare disease population, but now we're one of the few people working in the area to give them therapy that will normalize their lives.
Perfect. I appreciate your time, Doc.